the chairman and ladies and gentlemen, it's a great honor for me for invitation. Progression of IBD to colorectal cancer. And can you see here two-way IBD dysplasia, carcinoma, sequence, and cancer, and the second way develop polyp, dysplasia, and cancer. Colorectal cancer risk in IBD establish the risk factors: young age at the onset of IBD, extensive colonic involvement, long disease duration over 8 to 10 years, severity of inflammation, concomitant inflammation manifestation, genetic susceptibility, cytokines and growth factors, family history, smoking, presence of pseudopolyps and backwash ileitis. Comparison of CRC risk in patients with CD and ulcerative colitis, a population-based cohort study. It is the CD cohort, 181 patient, and ulcerative colitis cohort, 823 patient. Colorectal cancer is in extensive colitis. You can see here, it is the colon 22 observed cancer, rectum 7, total 28, and Crohn's disease, colon 8, rectum 2, and total 8 observed cancers. Patient with extensive ulcerative colitis and CD increases the risk for colorectal cancer. Patient with extensive CD, 18-fold increase CRC risk. Patient with extensive ulcerative colitis, 19-fold increase CRC risk. Young age of onset over 25 years. CRC risk is lower in patients with CD as patients undergo colectomy in an early stage in the disease. You can see on this slide this great line, interrupted grade line. Cumulative frequency of CRC in patients with extensive ulcer colitis and with Crohn's colitis, the full line. CRC risk in patients with extensive CD, evidence from meta-analysis. Patients with CD are from 2 to 3 times higher risk of CRC. Age onset of CRC was reported to be above 20 years early in these patients. CRC risk in patients with extensive ulcerative colitis, evidence from meta-analysis. Patients with ulcerative colitis are at 2.4 times higher risk of CRC. Male sex, young age, and onset of extensive colitis are the risk factors associated with CRC development. Chemoprevention of CRC, only if IBD patient of the whole population. Salicylate decrease CRC adenomas, 5-ASA, mesalazine, non-steroidal anti-inflammatory drugs, 5-fluorouracil, and monoclonal antibodies. Efficacy of 5-ASA in CRC prevention in patients with ulcer. Regular colonoscopy decrease 67%. Over to hospital visit, this patient 84%, local steroid 56, systemic steroid 7.4, 5-ASA, it is the important, over 1.2 gram per day, 81%. Regular ASA 75, and any other 5 ESE 52, only 52. 5-ASA mechanism of action activates PPIR, cell cycle checkpoint, and inhibits colonic epithelial cells proliferation, beta-catenin growth factor, and tumor necrosis factor alpha. Next slide. 5 ACA activity in cell cycle of CRC cells, evidence from in vitro studies. A concentration of 20 milligram mesalamine significantly interferes with the cell cycle of colorectal cancer cells. After 24 hours of incubation with mesalamine of concentration of over 35 milligram, cells proliferation levels are reduced even below the starting value, suggesting induction of apoptosis. Encourages cell death in the form of apoptosis, necrosis, and mitotic catastrophe, hence attaining in the dispensable goal of cancer therapy. 5 ASA reduced CRC risk in patients with IBD. And you can see 5 ASA over 1.2, 85%. The sulfasalazine various, only 66%, sulfasalazine 62%. Effect of 5 ASA on colorectal cancer risk. And this you can see in this slide, it is a VIS5 ESA green line, and without mesalamine, it is the gray line. Efficacy of 5 ESA in CRC prevention in patients with ulcerative colitis. As a control study, it is 102 patients of CRC in ulcerative colitis compared with matches controls. Efficacy of mesalamine in CRC prevention in patients with ulcerative colitis. It is the regular treatment with 5 ASA reduce the CRC risk a great extent. After adjustment of the variables, 5 ASA leads to 81 reduction of CRC risk. 5 ASA use in CRC risk in IBD, a large epidemiological study. This is the cohort of very large of 18,969 patients. 5 ASA use in CRC risk in IBD. Regular treatment with 5 ASA reduced the colorectal cancer risk when compared with irregular users, the effect being consistent with mesalazine. Effect of 5 ASA in CRC in patients with IBD case control study, cohort of 1,594 patients. Regular treatment with 5 ACA reduced the CRC risk in ulcerative colitis when compared with irregular users. Dutch Chairman and ladies and gentlemen, let me conclude. Patients with IBD are at increased risk of CRC. Chemotherapy of CRC included NSAID, pegfluorouracil, monoclonal antibodies, and chemoprophylaxis include salicylates and mesalazine. 5 ASA over 20 milligram induced in increased apoptosis in CRC cells. Regular use of mesalamine over 1.2 gram day significant reduced CRC risk. However, some of these results will be consistent and limited by heterogeneity involved. In the future, agonists EP4 receptor and receptor subtype prostaglandin E2, ulcerative colitis promote mucosal healing, KAG 308, EP4 orally available selective agonist only is mouse model. This is the publication Japan authors from Kyoto. This is the promising therapy strategy for ulcer colitis. And take-home message, the last slides, colonoscopy surveillance program and 5-aminosalicylates long-term use decrease incidence colorectal cancer in ulcer colitis. This echo guidelines for 2015. Thank you very much for your attention.